All right, so we have one area that we kind of need to touch on because it's not well described in the textbook. We have an injury or a medical issue of the nose. We talk about some of the other face traumas and whatnot, and that tends to be the more common things we deal with. But there's one that gets kind of left out throughout our textbook, and we'll touch on it a bit in a very, very short chapter here. Not much to read here, so just kind of follow along and pay attention. So what we're going to talk about in this short presentation is epistaxis. Epistaxis is the medical term for a bloody nose, and in most cases that's coming from up really towards the front of the nose. You've got the nasal cavity that goes quite a ways back in the head, but most hemorrhages tend to be up towards the front or towards the nostril side of the nose. Occasionally, though, there are some deeper into the back of the cavity there. So there are a number of traumatic causes of epistaxis, one of those being foreign bodies. That tends to be either accidental, somebody fell into something, or kids like to put things up there. Probably the most common cause in younger people would be digital trauma to their nose, and that digit being your finger. Facial and nasal surgeries occasionally are a cause of this, and then facial trauma, of course. Medical causes, we kind of talk about trauma nose issues, but the medical side of it is dry, heated indoor air, dry, hot, low humidity climates, allergies, sinusitis. Probably the biggest one medically is hypertension. People get a spike in their blood pressure and their nose starts to bleed. They may have a bleeding disorder or on some blood thinners. Upper respiratory infections cause this a bit, chemical irritation, vitamin K deficiency, which helps in blood clotting. So what we're often going to find is bleeding from the nose. It's possible that we'll see vomiting along with this. Depends on what they've learned throughout their days. A lot of people think you're supposed to tilt your head back, and you're not. You're supposed to tilt your head forward. Tilting your head back allows blood to run down your throat into your stomach and makes you nauseated. And they may have pain or tenderness around their nose as well. So how are we going to treat this? The anterior nosebleed, there's bleeding vessels in the front part of the nose. It's usually fairly easy to control. You usually pinch the fleshy part of the nostrils together for about 15 minutes. You can apply ice over the bridge of the nose as well, and sometimes pressure above the top teeth in your mouth helps reduce blood flow up to the nose. If you have a posterior nosebleed, though, you may have bleeding way back in the back. Not much we can do with that. In fact, they're going to need to take them into the emergency room and usually put something that's kind of a balloon or a type of a packing back there that can apply pressure where we can't. Once in a while, they'll go in there and even cauterize something or use a chemical cauterization to clot that off. Basically, if this is the case and they have a rapid, heavy nosebleed, you need to get them into the ER fairly quickly. It is possible for them to get shocky. It's not likely, but if so, obviously treat them for shock. Told you that was a short chapter.